Greetings, my name is John Paul Braun, and I'm a second-year medical student at Creighton University. I will be presenting a case report titled Hemorrhagic Stroke Secondary to Inflammatory Bowel Disease. But first, a brief introduction. Hypercoagulability is a rare but well-documented complication of ulcerative colitis, which can lead to severe health outcomes, including embolic cerebrovascular accidents. This case features a young adult with well-controlled ulcerative colitis who still developed a severe CVA. He required neurosurgical intervention and intensive care, but recovered without deficits. To be more specific, this was a 19-year-old male with ulcerative colitis treated with adalimumab, prednisone, and mesalamine. Initially, he presented to the emergency department with severe headache, nausea, and vomiting for the past 3 days. He was treated symptomatically and discharged in stable condition. However, he returned to the emergency department the following day with a worsening headache and confusion. Initial labs revealed severe iron deficiency anemia, hyponatremia, and a normal CRP. CT revealed intraparenchymal hemorrhage, and he was transferred to the ICU. While in the ICU, he received an emergent decompressive hemicraniectomy due to worsening intracranial pressure, and a post-op thrombectomy was performed to treat subsequent intracranial thromboses that had formed following the previous surgery. He was discharged to neuro rehab after 19 days in the ICU with no deficits. In order to explain this thrombosis in this patient, I looked into the literature regarding the pathophysiology of thrombosis in patients with IBD. Patients with IBD have a 2 to 3 times greater risk for thromboembolic events than the general population. One hypothesis posits that chronic inflammation seen with IBD induces procoagulative endothelial changes. However, given the well-controlled ulcerative colitis in this patient, it is more likely that iron deficiency anemia, secondary to ulcerative colitis, may have induced the thrombosis. And this is because iron deficiency anemia reduces the viscosity of blood and can increase the turbulence of blood flow, leading to the formation of thromboses. Next, I covered the importance of recognizing and addressing strokes in pediatric patients with inflammatory bowel diseases. This is important because pediatric patients with ulcerative colitis have a 3.3% chance of developing a cerebrovascular accident throughout the course of their disease. The most common presenting symptoms of a sinus venous thrombosis is persistent headache. And as was highlighted in this case, early recognition and treatment can lead to full neurological recovery in the pediatric population. Therefore, it is critical to maintain high suspicion for stroke in pediatric IBD patients. Thank you for listening, and take care.